Good afternoon, dear friends. The last video came out with a sharp criticism of doping and to keep objectivity, not just hate, because I understand that there are controversial points. In this video, we will talk about such an integral part of it as hormone replacement therapy, or HRT. But it is by no means propaganda. At the beginning, like the last video, it's more of a food for thought. With the development of technology, the quality of life of men and mankind in general is improving, living conditions, medicine, technology. All this leads us to the best time in history and as a consequence to hypodynamia, which primarily affects people. Scientists have noted that since the beginning of the 20th century, the content of testosterone in the blood of men tend to decline. This process continues to this day in modern life. Doctors are allocated every year more and more young men in their consultations, and many doctors and andrologists say that with problems to them more and more young people from 20 years old. Of course, problems with declining testosterone levels are not everyone, not always at different levels. But the total amount of testosterone content in the body of a man is lower than that of his fathers, grandfathers. There are characteristic signs of his decline in physical, sexual, and mental abilities. There are signs of abdominal obesity. And this is the brightest stigma of hormonal imbalance. If previously people with such problems turned to the doctor after 40 years, now everything has changed out of course. First of all, it is necessary to stimulate a natural production of testosterone to adhere to an active lifestyle and proper diet, try to eliminate bad habits, minimize stress. But this is only in dry theory. If all the recommendations did not help, only then it is worth thinking about HRT. It is not a panacea, and it should be attributed to some extent to doping, although here are used testosterone. For starters, who it's good for. The last video said something about testosterone being the main male hormone that regulates the vast majority of male health. An imbalance of testosterone and estrogen is directly linked to a variety of health problems. One report claimed that the average 54-year-old man has higher estrogen levels than a similar woman as young as 59. It may seem like just put testosterone and you'll be happy, but it's not that simple. The reasons why HRT doesn't work for most men is because exogenous testosterone can convert and increase estrogen levels, and this only worsens the imbalance problem. Estrogen is an essential hormone for men, but its overabundance causes a large number of health problems such as heart attack or prostate enlargement. In youth, a small amount of estrogen is used to maintain the powerful stimulating effect of testosterone, and as estrogen levels increase with age, it can reduce the effect of testosterone. Hence, due to the high concentration of estrogen, the brain believes that there is also an excess of testosterone in the blood, which in turn slows down the production of endogenous testosterone. This is due to the attachment of estrogen to receptors in the hypothalamus, and suppressed hypothalamus gives the pituitary gland information that it is necessary to suspend the production of luteinizing hormone, which is primarily needed for the production of testosterone. So it is possible to influence the high level of estrogen and can completely extinguish the normal endogenous production of testosterone in the body. Therefore, only a doctor should prescribe HRT according to the results of tests. Personally, I cannot put myself in any category regarding this topic. I try to be realistic and do not forget about the controversial and positive aspects. I do not burn any places about the naturalness of athletes, but I am always interested in the motives, and I do not judge. So if the analysis of total testosterone showed below 12 nanomoles per liter, you are very likely to be offered HRT. There are enough positive moments. The body composition changes for the better, i.e. the percentage of muscles increases and the amount of fat decreases. The sexual function experiences a second youth. We can also distinguish in general a certain rejuvenating effect on the body. All the negative is played back, but there is also the other side of the coin. After all, therapy is a great responsibility for the state of your body, constant monitoring of lipid profile. General clinical blood parameters. As a rule, doctors do not like to tell that in a couple of years. Yes, here are some of them. First of all, testosterone is not only a sex hormone. It is more correct to call it a hormone of the whole body, as it interacts with every cell in the body. 2. Testosterone plays the role of a prohormone. That is, it transforms it into estrogen and other metabolites that play an important role in physiology. Elevated estrogen is the main culprit in the problem of prostate enlargement, and while the fear of prostate cancer keeps many men from testosterone therapy, in fact, its deficiency predisposes to cancer. Testosterone is also blamed for impairing heart function, although in fact lower testosterone levels are a risk factor for heart disease than high cholesterol levels. Testosterone is the most powerful cardiovascular protector for men. It strengthens the heart muscle and reduces bad cholesterol, thinning the blood and reducing plaque formation. All these accusations have a questionable scientific basis. For example, total testosterone levels were measured instead of active free testosterone. Studies were conducted on testosterone in an incorrect form of therapy. Experiments were too short in time to show improvement, so after atrophy caused by testosterone deficiency, recovery takes about 6 to 12 months, while the study took about 1 to 2 months. A few words about the factors that cause estrogen-testosterone imbalance in men. If blood tests show high levels of estrogen and low testosterone, there are several factors that may be the cause. The first of them is the excess of aromatase enzyme. With age in the body of men, produced a large amount of aromatase is converted into testosterone. Suppression of aromatase enzyme gives a significant decrease in the level and at the same time increase the amount of free testosterone. The second factor is obesity. Living cells produce aromatase enzyme. And a little bit about hormone replacement therapy in women. Recently, a very large clinical trial was completed comparing menopausal women who underwent ovarian shutdown with the efficacy of aromatase inhibitors and tamoxifen. And unfortunately, the advantages of prescribing aromatase inhibitors in this situation were not revealed. Of course, there is a chance that still some of the subgroups won. But in the study, the effect dissolved in the general population of results that did not benefit from it, so the gain is not called some huge in any case. According to international recommendations in women before the onset of natural menopause, tamoxifen is the standard approach of treatment and the course is chosen. Of course, after talking to a doctor and passing all the necessary tests. And what do we get as a result? As a rule, HRT is most often a one-way road. Testosterone doses during HRT should provide first of all health and well-being. It is not a professional sport where the goal is the growth of athletic performance and increase in fitness improvement, where they are much higher. Although on therapy the results are also very high, still it is a high level of testosterone. For professional athletes, HRT is something like a decent sports pension. You can talk about this topic for a long time and see that I have a friend who did a course of therapy, climbed down, and everything was cool. But no, not everyone can get out normally. Even if we take the experience of doping and repeat here, we support the work of testicles by regular injection of HCG. We stimulate Leydig and Sertoli cells. But we still cannot provide normal work of the hypothalamus pituitary arc. Their function is suppressed, and the more they do not work in terms of gonadotropin production, the more problematic it is to put them to work. In any case, it is better when a person makes such decisions consciously, and it is not necessary to blindly condemn or encourage. It is necessary to approach objectively, trying to get as much information as possible from different sources and about what consequences can be expected when making a choice. Competent decisions about the use of hormone therapy can only be given by a doctor, because the hormonal system is a very delicate mechanism. That's all for today. Subscribe to not miss new videos. Thank you for your attention, and I'll see you in the new video. Bye.